Hello, audiology and speech-language pathology clinical educators. First, we'd like to thank you for agreeing to supervise an audiology or SLP student. Today, we will be introducing you to the Canadian Assessment of Clinical Competence, or ACC, a clinical education performance assessment tool to be used with audiology and SLP students. We recommend that you follow along this presentation with the ACC tool in hand. During today's webinar, we will provide an introduction to the ACC, as well as background information on why we have developed this tool for use with students in Canada. We will discuss how to use the ACC tool and then guide you through its application using case scenarios. Please note that the material is organized into 5 modules. Feel free to skip ahead if some content is already known to you. By the end of this webinar, you will be able to apply competency-based assessment principles to the new ACC tool, identify a student's performance level, and determine next steps for learning using the milestones. First, an introduction to the ACC in Module 1. The Canadian Assessment of Clinical Competence, or ACC, is a competency-based assessment tool designed to assess the performance of speech-language pathology and audiology students in clinical placements. The ACC was developed by the academic coordinators of clinical education from all 12 speech-language pathology and audiology university programs across Canada, listed here in order from West Coast to East Coast. Here is the list of academic coordinators of clinical education, or ACEs, who have participated in the development of the Canadian Assessment of Clinical Competence over the years, listed here in alphabetical order. In Module 2, we will provide you with information about competency-based education and assessment before diving into the development of the ACC tool and how to use it. Competency-based education is an outcomes-based approach to the design, implementation, assessment, and evaluation of education programs using a framework of competencies. More specifically, in the traditional education approach, emphasis is placed on what knowledge students need to be taught and how we will teach them that knowledge. It places much of the responsibility on the instructor. In the competency-based education approach, however, the focus is on the abilities of the student and the competencies they are expected to demonstrate by the end of the program. This approach helps to promote learner responsibility. Please take a few moments to compare and contrast these two approaches. Assessing student performance using the traditional method focused on the assessment of learning and knowledge. Competency-based assessment, however, involves assessment for student learning and their application of that learning. It focuses on self-improvement, whereby students receive and apply feedback to develop clinical competencies. For more information on competency-based education and assessment, see resources slide at the end of the presentation. The ACC requires a shift in thinking for clinical educators to a competency-based educational approach. This involves a shift in focus from disorder or population-specific knowledge and skills to abilities that transfer across disorders and placements. For example, a student may complete their first placement with a preschool speech and language population, and then in their next placement work with adults with aphasia. The student will draw on the skills they've learned from the first placement, such as applying academic knowledge to a clinical case, sub and superstepping within a treatment session, and communicating clearly to a client, to this new population. Students in CEs will still address population-specific skills and knowledge throughout a placement. However, the formal assessments will focus more broadly on transferable competencies. We will now provide a brief history of the development of the ACC. In 2005, the Royal College of Physicians and Surgeons of Canada adopted the CanMEDS framework based on the Educating Future Physicians of Ontario project, thereby moving toward a competency-based approach to medical education. Following adoption of the CanMEDS model in medicine, other health professions, such as physiotherapy and occupational therapy, began to follow suit and move away from the traditional approach to education and assessment toward the competency-based approach. In 2011, the Canadian Interorganizational Steering Group for Audiology and Speech-Language Pathology, or CISG, proposed competencies that served to pave the way for competency-based curricula in Canadian university audiology and SLP programs. In 2014, the Canadian Council of University Programs in Communication Sciences and Disorders, or CCUP-CSD, tasked the Canadian Academic Coordinators of Clinical Education, the group of audiology and SLP clinical coordinators within Canada, with developing a national assessment tool. In May 2018, the Canadian Alliance of Audiology and Speech-Language Pathology Regulators, or CASPR, outlined professional competencies required of each clinician upon entry to practice in Canada, with the goal of safe and effective practice. The Canadian Academic Coordinators of Clinical Education developed the current ACC tool over a number of years, starting with the revision of the 2011 CISG competencies, with consideration for the CASLPA foundations, and later integrating the 2018 CASPR competencies, into which we also provided expert input. Since then, the CACCE group has reviewed existing tools, for instance, competency tools for audiologists and SLPs in Australia, as well as OT and PT competency assessment tools here in Canada, created milestones for use with the tool, and translated the tool into French before piloting it across the country with audiology and SLP clinical educators in 2023. As you may know, the national competency profiles are distributed across 7 roles required of a speech-language pathologist or audiologist. These roles include expert, which is further broken down into knowledge expert and clinical expert, communicator, collaborator, advocate, scholar, manager, and professional. Each of these roles further describes competencies that audiologists and speech-language pathologists are required to bring to every aspect of their professional lives. We will discuss this further on the next slide, but before we do that, it is important to note that there are differences between the audiology and SLP expert roles, given the different scopes of practice for audiologists and speech-language pathologists. However, the content of the remaining 6 roles are identical for both audiology and SLP. The ACC, introduced to you today, was developed using these professional competencies as a starting point and adapting them to allow for appropriate assessment of audiology and speech-language pathology students in clinical placements across various stages of learning. To review the national competency profiles, please see the link on the resources slide in Module 5. Final reminders. Before we explain the ACC tool in more detail, we would like to provide a few definitions to ensure clarity. As mentioned on the previous slide, roles refer to the broad functions required of an audiologist or speech-language pathologist. CASPR's 2018 competency profiles included 7 roles for audiologists and speech-language pathologists, including, for example, expert and collaborator. The 7 competency roles in the ACC exactly match those from the CASPR competency profiles. Each role contains 1 or more essential competencies that the student must demonstrate by the time they complete their studies. Essential competencies are abilities required of an audiologist or speech-language pathologist upon entry to practice in Canada. They describe observable behaviors such as establishing and maintaining effective collaborations to optimize client outcomes, or maintaining professional demeanor in all clinical interactions and settings. Sub-competencies are a key component of an essential competency. The combination of multiple sub-competencies helps to better describe the components of an essential competency. For example, maintain confidentiality and demonstrate professionalism in managing conflict are just 2 sub-competencies that make up the essential competency of maintaining professional demeanor in all clinical interactions and settings. The 23 essential competencies and associated sub-competencies largely match those listed in the CASPR competency profiles. However, some changes, including additions and consolidations, were made to include skills and attributes important for clinical placement success, and to describe skills in terms that were meaningful for clinical placement settings. Finally, milestones have been added to the ACC tool to make competencies more explicit and practical when assessing student performance in a clinical placement. They are a descriptive roadmap that focuses on the continuum of learning or developing clinical competence from the novice level to the entry to practice level. To further clarify these definitions, let's have a look at a section of the collaborator role. In the ACC tool, you will see every section starts with the role. Below the role is the essential competency, and below that, the sub-competencies. Lastly, the milestones, which you see here in a chart below the sub-competency, are contained in a separate but similarly organized document. One of the essential competencies in the collaborator role is demonstrate client-centered practice. Under the essential competency, you will see one or more sub-competencies. A sub-competency of the larger essential competency here is that the student engages and supports the client in identifying concerns, priorities, etc., to inform assessment and intervention. Further accompanying the ACC in a separate document, we have included milestones for each sub-competency. These milestones give practical and concrete examples of what students at various stages would typically be able to do. They make competencies more explicit and practical when assessing student performance in a clinical placement. The milestones also provide a guide for student development as they progress in developing competencies. In Module 3, we will discuss how to use the ACC tool to assess a student's level of clinical competence. The first step is to use the rating scale to assign the student a rating for each of the 23 essential competencies in the ACC. This Likert rating scale accompanies the Assessment of Clinical Competence tool and describes the expected performance of a student at 7 points along a continuum ranging from unsatisfactory to entry to practice. While most students in an initial placement will start at early novice, unsatisfactory is also an option to reflect students with significant difficulties. Ratings are made for each of the 23 essential competencies with 3 factors considered. First, the amount of guidance or clinical educator support, including frequency and specificity of guidance. Second, situational complexity, such as familiar/routine to complex situations. And third, length of time required to complete a task or clinical activity. You may choose how to weigh the relative importance of the 3 elements to best suit your own context and reflect the student's competency. On occasion, a competency will not be applicable for a particular setting. In these circumstances, you should select Not Applicable. Before you select Not Applicable, it is important to refer to the milestones to ensure you are not overlooking a performance that could be rated. Over the course of their master's program, students are expected to progress from early novice, in the early stages of their first placement, to entry to practice, at the end of their final placement. Individual university programs may identify required achievement levels along this continuum that match the timing of their particular placement offerings. Also, it is important to note that entry to practice is the highest rating on the scale for audiology and speech-language pathology students, but it is not technically the end of the continuum. Once these students graduate, they will continue their professional development, moving further along the continuum to proficient and even expert in a particular area of practice. Let's look a little more closely at how one of the factors, amount of guidance or clinical educator support, changes as a student progresses along the scale. An early novice student requires specific guidance, such as the CE modeling a task first, for all tasks they do. An intermediate student may only require specific guidance like modeling for less familiar tasks. For routine tasks, they would only require general guidance, like a cue or reminder. At the entry to practice level, the student can handle most familiar tasks independently, only sometimes requiring general guidance. though if a task is very complex or unfamiliar, they can still require specific guidance. It is important to consider the specifics of your own clinical setting and caseload when applying this rating scale. A student working in dysphagia in a final placement may not be as independent as a student in a developmental language placement. However, given the complexity and familiarity of the tasks, they may both be demonstrating entry to practice level competence. Critically, when you are assessing a student in their final placement, you must remember that entry to practice level competence does not mean that the student can perform your job the same way you can. Rather, by the end of their final placement, they should resemble a new grad starting their first job in your setting. They will still be learning, still be working on efficiency, still need mentorship, particularly when working on complex cases, the same way that a new grad does. When using the ACC, first reflect on the student's performance for each of the essential competencies, using the descriptors on the rating scale to help you determine their current level. In this example, you would consider how to rate the student on Essential Competency 1.2.D, analyzes and interprets assessment results. Using the rating scale descriptors as a guide, you would consider how much time the student takes, the amount of guidance they need, and the level of complexity of the tasks in order to determine the student's rating on this essential competency. When determining which rating to assign for the essential competency, the clinical educator needs to consider the student's performance on the applicable subcompetencies below each essential competency. In the ACC tool, one or more subcompetencies will be listed under each essential competency. As the clinical educator, you will consider the applicable subcompetencies listed below each essential competency to make an overall determination of the student's rating on that competency. In this example, there are 4 subcompetencies under the essential competency demonstrates client-centered practice to consider when assigning a rating for the student. It's okay if you haven't observed all subcompetencies under a given essential competency. Consider those that you have observed and rate the essential competency based on those. When needed, clinical educators can review the associated milestones to further inform the ratings they choose for the student. As mentioned previously when we reviewed ACC definitions and terms, milestones provide more explicit and practical expectations of student performance on a given competency. They focus on the continuum of developing clinical competence from novice to entry to practice. Clinical educators may find it helpful to review the milestones in order to determine if the rating they initially thought would best reflect the student's level of performance is in fact confirmed by the milestones. Milestones also help to link the competencies to clinical practice, allow for planning and teaching within the clinical placement, and can support self-directed assessment by the student. The milestones are observable behaviors that describe what the student could be doing at each level. Milestones are a pathway that can also be used to guide the student's next steps in the development of a subcompetency and determine specific areas for development within the placement. For example, the novice level student can identify strategies that the clinical educator uses to support the client within sessions. As a next step in the placement, the clinical educator and student may discuss possible strategies, and then the student will plan to use those pre-planned strategies to support clients in future sessions. In Step 4, you will add your comments to the assessment form. For each of the 7 roles, summary comments from the CE should be added regarding the student's strengths and areas for development. This is an opportunity to relate more specifically to the placement population or setting, to highlight the more relevant essential competencies, and to indicate the next steps for development. These comments are incredibly valuable for the student in their continued development. The 5th and final step is the discussion with the student. It's important to meet with the student to discuss your ratings. Have your student bring their own self-assessment so you can discuss perspectives and finalize ratings. Refer to milestones as a guide or pathway to identify next steps. In summary, we recommend that clinical educators follow these steps when using the Assessment of Clinical Competence tool. 1. Reflect on student performance in order to rate each of the essential competencies. 2. Consider the corresponding sub-competencies when making your ratings. 3. If needed, review the milestones to further guide your ratings. 4. Add your comments regarding the student's performance. And 5. Discuss with students using milestones to determine next steps. We will now practice using the ACC tool to rate student performance through case scenarios. Please be sure to have the full ACC tool on hand for these exercises. It is important to go through each scenario no matter your profession, as most competencies are applicable to both. Layla is an audiology student on her 3rd clinical placement. She is over halfway through her master's program. She has planned and completed several assessments in the first half of her placement with growing independence. She requires specific cueing, i.e. modeling, to complete new and unfamiliar assessments with complex cases or when there are behavior difficulties, but performs familiar assessments with only general guidance from her clinical educator. Her clinical educator has observed that she struggles with writing accurate assessment reports. She requires structured templates and examples of written reports, is unable to explain complex assessment results, and takes extra time to write all reports. Reports usually require 3 revisions before they meet requirements to release to the client. Layla's CE is rating her at the midterm of her 3rd clinical placement. The essential competencies that are relevant for this case include 1.2.B, Role of Expert Audiology, Plans, Conducts, and Adjusts an Assessment, and 2.B, Role of Communicator, Audiology, and Speech-Language Pathology, completes documentation thoroughly and accurately in a timely manner. Remember that Layla is an audiology student, and for the expert role, the essential competencies and sub-competencies are different than for SLP. You should see this content for sub-competency 1.2.B on your audiology tool. The key points for rating this student include that familiar assessments need general guidance and new assessments for complex cases or behaviors need modeling and structure. So we have observed degree of guidance needed and situational complexity, and these inform our rating. Given this information, you should be able to rate this student on the rating scale. What rating would you assign this student for this essential competency? At the midterm assessment, the CE rated Layla at the intermediate level. The key points for rating this student at intermediate level include that familiar assessments need general guidance and new assessments for complex cases or behaviors need modeling and structure. We have observed degree of guidance needed and situational complexity, and these inform our rating. Now we will consider the communicator role, and this is the same for both audiology and SLP. We are considering the competency 2.B, completes documentation thoroughly and accurately in a timely manner. You should see this content for sub-competency 2.B on your tool. The key points for rating this student include that there is a need for templates and examples from the CE to achieve accurate assessment report writing. There is an inability to explain complex results, and it takes 3 revisions and extra time to complete all reports, both familiar and complex. How would you rate this student on this competency? At the midterm assessment, the CE rated Layla at the early novice level. The key points for rating this student at the early novice level include the need for templates and examples from the CE to achieve accurate assessment report writing, the inability to explain complex results, and the fact that it takes 3 revisions and extra time for all reports. Consider the second case example. Stefan is finishing his first speech-language pathology placement. The placement is taking place in a busy clinical setting with many professionals, patients, and family members around. Stefan has been highly aware of the need to maintain confidentiality and has independently adopted strategies to keep from speaking about a patient in an area where he could be inadvertently overheard. He has not managed conflict directly, but witnessed a significant difference of opinion between a physician and a physiotherapist. In a follow-up discussion with his CE, he had insight into a more productive management of this conflict and needed only general feedback to consider some additional points and refine his ideas. Stefan has participated in a mix of one-on-one and group interventions for adults with acquired brain injuries. Prior to this, he received summaries from his CE describing strengths and challenges for each client, and they worked together to translate previous assessment results into goals, approaches, and interventions. Stefan initially needed frequent support to select and write short versus long-term goals, but is now able to develop his own approaches for goals in one-on-one sessions. He requires greater assistance for approaches to group intervention. He is also unsure of outcome measurement, but when provided with examples, he can add 1 or 2 appropriate outcome measures. For this case, please consider how you would rate the essential competencies for 7A, Role of Professional, Audiology and Speech-Language Pathology, maintains professional demeanor in all clinical interactions and settings, and 1.3.A, Role of Expert Speech-Language Pathology, develops a realistic, evidence-informed, and measurable intervention plan. You should see this content for 7.A on your tool. The key points for rating this student are his maintenance of client confidentiality and his insight into how to productively manage conflict. How would you rate Stefan on competency 7.A, maintains professional demeanor in all clinical interactions and settings? At the final assessment, the CE rated Stefan at the advanced intermediate level for this essential competency. The key points for rating this student as advanced intermediate are his near independence in managing both client confidentiality and interprofessional conflict. You should see this content for 1.3.A on your speech-language pathology tool. Now, let's rate Stefan on 1.3.A, develops a realistic, evidence-informed, and measurable intervention plan. The key points here are that he needs CE support to develop goals for group intervention and appropriate outcome measures, and that he can develop goals for one-on-one sessions on his own. How would you rate Stefan on 1.3.A, develops a realistic, evidence-informed, and measurable intervention plan? The CE rated Stefan as an advanced novice for this competency. The key points for rating this student as advanced novice are that he needs the CE support to develop goals for group intervention and appropriate outcome measures, but he can develop goals for one-on-one sessions on his own. Please consider this third example. Geneviève is at the midpoint of her final placement in speech-language pathology, providing services to children in a regional children's treatment center. While some of the children are straightforward, many have complex physical, cognitive, and emotional needs. Geneviève has been doing well planning assessments and readying the materials in room. She effectively and independently conducts clinical interviews with parents. When assessing a child, she is reasonably comfortable administering and adapting standardized tests, but struggles with informal assessment. She plans for a range of methods to elicit responses. However, she needs specific prompts in the moment for this context. She manages common behavioral issues during assessments, yet is unable to manage more complex behaviors. She is usually accurate in recording the children's responses, but struggles to do the same in informal assessment with complex behaviors. Geneviève has a strong awareness of her strengths and areas for development. At the end of each day, she prepares a list of 2 to 3 skills to focus on improving for the next day. Her CE has always agreed with her choices. Prior to her midterm assessment, Geneviève independently completed a formal analysis of her challenges with informal assessment techniques and complex behavior management, provided her improvement plan, and included questions for the CE's input. Now we will consider rating two essential competencies. 1.2.C, Role of Expert Speech-Language Pathology Conducts an Assessment, and 5.A, Role of Scholar, Speech-Language Pathology and Audiology, maintains currency of professional knowledge and performance in order to provide optimal care. You should see this content for 1.2.C on your speech-language pathology tool. The key points for rating this student are: Geneviève does well in planning assessments, readies materials and room, and conducts interviews well. But she struggles with informal assessment and requires support during the session in all areas: eliciting responses, managing behaviors, and recording responses. How would you rate Geneviève on Competency 1.2.C, Conducts an Assessment? Based on the rating scale, the CE has rated Geneviève as intermediate for this competency at midterm. The key points for rating this student as intermediate are: Geneviève does well in planning assessments, readies material and room, and conducts interviews well, but she struggles with informal assessment and requires support during the session in all areas: eliciting responses, managing behaviors, and recording responses. The other competency we are considering is 5.A, maintains currency of professional knowledge and performance in order to provide optimal care. You should see this content for subcompetency 5.A on your tool. The key points for rating this student include her strong self-awareness, ability to create appropriate self-development goals, initiative to evaluate herself in clinical skills, and independent development of an improvement plan. How would you rate Geneviève on Competency 5.A, maintains currency of professional knowledge and performance in order to provide optimal care? Using the rating scale, the CE has rated Geneviève as entry to practice for this competency at midterm. The key points for rating this student as entry to practice include her strong self-awareness, her ability to create appropriate self-development goals, her initiative to evaluate herself in clinical skills, and her independent development of an improvement plan. Before discussing our final case example, we would like to remind you of the milestones that accompany the ACC tool. There may be times when a decision about a competency rating is unclear. In this situation, you would have to go deeper than the subcompetencies within an essential competency. For each subcompetency, observable benchmarks called milestones have been developed to assist in rating that subcompetency. For example, if you are unable to assign a rating from the scale because your observations fall between two levels, then specific tasks or milestones are needed to guide an accurate rating. Our final example will demonstrate use of milestones. Charlie is a polite and enthusiastic speech-language pathology student in a final placement who understands clinical service and follows policies. Their session planning and SOAP notes have been excellent. Early in the placement, they reported considerable stress due to the amount of time they were spending outside of regular placement hours trying to keep up with session preparation and documentation tasks for their assigned caseload. Their caseload represents approximately 50% of the clinical educator's usual workload, and the quality of their completed work is appropriate for their level. Charlie has not provided any further details or solutions for this ongoing issue. The clinical educator has provided them with a priority-setting tool to help them identify priorities and appropriately allocate time, and has also provided planning and note-taking templates with samples. As midterm approaches, Charlie is still spending excessive time outside of placement hours and is struggling to apply the provided materials. The clinical educator has also noticed that they have missed 2 deadlines on 2 important assessment reports, delays for which they did not provide notice or explanation. The clinical educator is going to try giving them a time limit and having them submit a draft of their work when the time is done. Charlie's clinical educator completed the midterm assessment. Now we will consider rating Essential Competency 6.A, Role of Manager, Speech-Language Pathology and Audiology, manages the clinical setting and priorities. You should see this content for 6.A on your tool. The key points for rating this student at midterm include: Charlie has demonstrated a clear understanding of the clinical service and follows all protocols and policies. However, Charlie is experiencing stress due to the amount of time needed to complete tasks, even though they are only working with 50% of the caseload. Despite the fact that Charlie has been given tools and templates to support time management, the situation has not improved. Too much time continues to be required for report writing, and important deadlines have been missed. How would you rate Charlie on Competency 6.A? The range in Charlie's performance on this competency leaves the clinical educator deliberating between several potential ratings. Charlie demonstrates good understanding of clinical services and an ability to follow protocols and policies without much guidance, which would lead to a higher rating on the rating scale. But when you consider the high stress for only 50% of the caseload, an apparent inability to manage time, and missing deadlines, it would appear that the student requires frequent and specific guidance and extra time for many tasks that would lead to a much lower rating on the scale for this essential competency. This is a situation in which the milestones will be helpful and should be consulted for a final decision on a rating. Each sub-competency has milestones at 3 anchor points: novice, intermediate, and entry to practice. For the role of manager, there is 1 competency: manages the clinical setting and priorities. Under this essential competency, there are 4 sub-competencies that should be reviewed by the clinical educator to determine a rating. Here, we show you the milestones for 1 sub-competency, 6.A.1, balances competing demands to manage time, caseload, and resources. The milestone offers the clinical educator a practical guide and behavior-based description of expected performance. For each sub-competency, you would look at which milestones the student is meeting. After considering where the student is performing on each sub-competency, you would decide on a final rating for the essential competency. On this sub-competency, the clinical educator realized that due to their inability to meet assigned deadlines, Charlie was not even meeting novice expectations. For this reason, Charlie was rated at the early novice level on this sub-competency. For sub-competency 6.A.2, demonstrates an understanding of the structure, funding, and function of service within the organization and broader health and education system, the clinical educator gave a rating of intermediate, because, during discussions with the CE, Charlie had previously demonstrated their clear understanding of SLP services within the organization. For sub-competency 6.A.3, applies appropriate precautions, risk management, and infection control measures as required, the clinical educator gave a rating of novice, because although Charlie follows safety protocols, they are not managing risks associated with delayed documentation. For sub-competency 6.A.4, ensure equipment, materials, and instruments and devices are regularly calibrated, up to date, and in good working condition according to the required standards, the clinical educator gave a rating of intermediate because Charlie is following procedures, protocols, and standards. With the additional guidance from the milestones, where would you rate this student on the essential competency 6.A, manages the clinical setting and priorities? After a review of the milestones for each sub-competency, the clinical educator rated this student at an early novice level for this competency, manages the clinical setting and priorities, on the midterm assessment. Although Charlie was sometimes demonstrating milestones at the novice and intermediate levels, the importance of sub-competency 6.A.1, balances competing demands to manage time, caseload, resources, and priorities, was considered most critical of these subcompetencies for this student in this placement, and so a rating of early novice was ultimately assigned. In a case like this, it would be important to justify your rationale for this rating in the comment section of the assessment form. If you're ever unsure of how to rate a student, please reach out to the coordinator of clinical education at the university to discuss further. In order to promote development of Charlie's skills within this subcompetency, the CE and Charlie should review the milestones to determine the next steps in development and concrete targets that are expected in the last half of the placement to move their skills to the entry to practice level. For example, Charlie must meet all assigned deadlines now, which is demonstration of abilities at the novice level. Then, in the next couple of weeks, Charlie should focus on client-related priorities. And finally, Charlie should focus on managing all priorities in all areas. Additional tools and strategies that would assist Charlie in meeting these expectations would also be needed. In this situation, the CE needs to contact the coordinator of clinical education to discuss their concerns and to get support for the development of a plan to promote learning and development. To conclude our presentation, a quick review. At the beginning of the presentation, we presented the learning objectives. During the presentation, we discussed competency-based assessment and how to use the new ACC tool. We reviewed a few case studies to help you apply the ACC tool, and now you will use this tool with your own SLP or audiology student. As a reminder, this is how we recommend you use the tool. First, using the rating scale, reflect on student performance in order to rate each of the essential competencies. Second, consider the corresponding subcompetencies when making your ratings. Third, if you are unsure of which rating to use for a particular essential competency, please use the milestones to guide your ratings. Fourth, add comments to the assessment tool. And fifth, discuss the assessment with the student. As you are using the tool to assess your student, please recall that the ACC requires a shift in thinking for clinical educators to a competency-based educational approach. This involves a shift in focus from disorder or population-specific knowledge and skills to abilities that transfer across disorders and placements. If you have any questions about the ACC and using it to assess your student, please reach out to the Academic Coordinator of Clinical Education at the Students' University for more assistance. If you have questions about competency-based education more generally, we invite you to consult the literature in the resources slide.